to introduce our panelist today, Elizabeth. She is our super mentor and interview trainer. It is our pleasure and with great privilege, I would like to invite and welcome Elizabeth, a fifth year medical student at Keele University, UK. With a passion of mentoring aspiring medical students, a graduate of the British Council School in Madrid, Elizabeth has first-hand experience in MMIs and panel interviews. As you can see, she is studying in Kiel, so she has cracked the interview and she has got into the university. With her strong background in teaching English, science, and collaboration with organizations like William Farr Academy, Elizabeth is here to share expert guidance to help you succeed in your journey towards a medical career. Elizabeth has been associated with Gyanbei since last 1 year, and she has helped students who have graduated and enrolled in the 2024 intake as well. So, Elizabeth, would you like to introduce yourself and how was your journey with Gyanberry assisting our students in the last year intake?
Thank you for the introduction. I think you've said most of it. But yeah, my name is Elizabeth. It's been great helping students, seeing how they improve throughout the session, and just seeing they're more confident in answering certain questions has been great. And I'm glad I can help students get into the schools they want to.
Great. Thank you, Elizabeth. So, without wasting any more time, we will start with a question. Sorry, I can't see you, Elizabeth. Are you there?
Yeah.
Yeah. Great. So, we will start with our set of questions, which kind of FAQ, which we always receive from the students. So, we will start with that. If you can just introduce the type of interview, kind of interviews that student can expect. What kind of interviews are available and how do they differ?
Okay, so can everyone see the table?
Yes,
yeah,
we can.
Yeah, that's great. So there's three main interviews structures that they may pose in different universities. It just depends on the university itself. So you have the multiple mini interview, the panel interview, and the one-to-one interviews. And obviously each of them have their benefits, each of them have their difficulties. It just depends which one you're more confident with. But it's good once you know you have an interview to practice that specific interview structure, just because they differ quite a lot between them. So the multiple mini interview, they're just short stations. It can be up to 10 with different scenarios or questions in each. They just try to assess different range of skills, things like communications, ethics, teamwork, problem solving, empathy. And they usually last about 7 to 10 minutes. And as I mentioned, they focus on specific skills that the university wants to see if you do have, or things that they're specifically looking for, basically. Advantages, obviously they're assessing a wide range of traits, which in my experience reduces stress, because you might be a bit better at certain traits than in others, so you can highlight those traits more than others, but it will balance out. Obviously it's good to practice everything, but you might be better at some things than others, so you can show this in that interview. Challenges, it can be tiring. Obviously it can be up to 10 stations lasting 10 minutes, so it can go on for a while. But it's true that it's really fast paced, so it doesn't feel like you're there for that long. But it requires adaptability, because each station's different. So you might go from one that you're talking about ethics, and then you might go one that's about problem solving. So you have to be able to change that chip and be able to adapt to different scenarios. Then you have the panel interviews. This can be up to 4 interviewers asking you questions in more of a conversational type format. assessing same types of things: communication, your motivation to study medicine, your values. But in this case, the questions can be more of like your personal background, asking you about current issues in the country you're applying to, or more worldwide. I feel like it's also less stressful because you can build some sort of like relationship or rapport with the interviewers. So it depends on the type of person you are, but that can make you feel a bit more comfortable. But it can be a bit repetitive. Some of the questions might be quite similar, so you might feel like you're answering the same questions, but you're not. That's just how the interview is set. And then last one is one-to-one interview. So this is just a single interviewer asking you questions. Same things, really, assessing your motivation, how well you fit into that university. The interview can last up to an hour, 30 to 60 minutes. In terms of advantage, I think it's more of a personal type interaction, less intimidated because you're only one person. So if you feel like you've built a nice rapport with that interviewer, it might feel just like a conversational type interviewer. And it's true that it may assess less traits because it's mostly more of a personal one-to-one interview where they're looking at why you want, like, what's your motivation and what are your values. So, but it's still the interview is still trying to see how you can fit in their university, and so it's still assessing sort of the same type of skills, basically. So that's a good just summary of the 3 different types of interviews that you can come face to face in your university, and how, yeah.
Great. I think this is a very good way of explaining all the 3 different, structures of interview.
Yeah.
So we will start with MMI kind of questions. Before that, there are a lot of students who ask this question that, irrespective of whatever interview pattern is, how should they structure their answers when they are specifically asked about why medicine or dentistry, or like tell us about yourself, because I'm sure this question will be asked for all the interview patterns.
Okay. Yeah. Obviously it's a question that all interviewers are gonna ask because they're just one of those typical questions that they need to figure out if you're a good fit for that university. The way I like to structure it is using a past, present, future type structure. So let me just share. So this is how I like to structure it. So in the question of why medicine, why dentistry, you can start thinking about the past. So explain what are your previous experiences, or what previously has influenced you to make that decision to study medicine or dentistry. So if you've had anything that's happened in your childhood, or anyone in the family is within that has studied medicine or dentistry, you can explain that and how that has influenced you to want to study medicine or dentistry. Then you can think about the present. So discuss what sort of things you've done to pursue that interest. So if you've done any volunteering work, any projects, any research, any work shadowing in any healthcare communities, things like that would be quite useful. And then you can consider the future because it shows some commitment to the career. So you can think about long-term career goals in the field, if you have any interest specifically. So if you want to go into research, or you're interested in specific parts of medicine or dentistry, you can explain this further, and that will show more of a commitment that you may have to that career. So I think this is a good way to structure it, and this is how I teach the students I see, and how I did it in my interview.
Okay, that's really good. Another important question which we get is it very important for the students to research about the university in advance? Like, is it important to know everything about the university where they are going for interview?
Mhm. Yeah, I think it is. Personally, I think it shows genuine interest in the program and the interest and the university you're applying to. And interviewers always love students that know something about the university or that course and explain it during the interview process. So I think another good thing is if you do know a lot about the university or the course, you're able to align your answers a bit to their ethos. So if you know they're really like interested in community service or academic excellence, you can try and align your answers um, to that. And then also usually at the end of interviews, the interviewer will ask you, do you have any questions for us? So I think that's also useful if you do know a bit about the university, because you can ask questions related to what you've researched, and that also shows the interviewer that you're interested in that specific university.
Right. Okay. Now, if let's say a student does not have a lot of work experience, or let's say shadowing, because it's not very easy for every student to get through internship or doctor shadowing.
Mhm.
So, if let's say they have not done so much, but they have relevant voluntary work in the school, but maybe not relevant to medicine, uh, will that help, or how effectively they can put it to the interviewer?
So definitely, any sort of volunteering work, projects, research that you've done will help. So you can link that with things like, because obviously they're looking for, as I mentioned before, different skills. So things like teamwork, leadership, those are really useful in the healthcare career. So I think if you can shift those answers, saying that I was able to work as a team and I learned these certain skills, or I was able to adapt a leadership type role and learn these things. Or you can talk about empathy. If something went wrong, how did you overcome that thing and how did you help your team members? So I think it is very useful. Even if it doesn't have to do anything with healthcare, I think it's still useful to comment about those things. Definitely.
Okay. Um, okay, so my next question, we can probably do it, one by one. We can start with the MMI specific questions. So what kind of sessions you have already mentioned regarding role play, ethical dilemmas, and teamwork scenarios? How should students approach ethical scenario, teamwork, that kind of question? If like they might get little confused, they might not know what exactly. So how do they approach such stations?
Okay, so I think everyone finds this difficult at first because it's important to have some sort of structure to your answer, so you don't spend a lot of time in a certain bit and not mention others. So I think initially it's really important to identify the issue. So what's the specific ethical dilemma that you're discussing? Once you've identified that, it's really easy to have an answer to it. Then, so once you've identified the ethical issue, you need to weigh up the options. So it's always going to be an ethical issue where they make you choose between certain options, or they make you think about what you would do in certain scenarios. So you need to give a range of options and consider the consequences to each of these options. And I always tell all my students to to communicate these options out loud, because the interviewer doesn't know what you're thinking. So it's important to talk whilst you're thinking. So and reason it. And it's important to reason it, show the interviewer how you've arrived to that decision, demonstrate your understanding on that ethical dilemma, and explain the ethical dilemma to them. And then finally, get to so imagine you've decided on one specific option, and after giving the reason into all the options you've considered. You've decided one specific option. You should explain why that option is the best option in this case, why you've considered that option, and always know that there's alternative solutions. So make sure you do mention those alternative solutions or compromises that you would make in that scenario.
Okay, so there are two questions linked to this answer of yours. So one is when they are talking about something which they have derived or they have done the research. Sometimes they talk a lot about I have done this or I have, sometimes it may sound a little bit boastful about themselves. So where do they cut that line on how they should they understand the difference between talking about what they have done but not being boastful?
Yeah. So I think in this case, it's important to explain. So don't list what you've done, because obviously interviewers know everyone that's given the opportunity to have an interview has done a list of things or needs a list of requirements, so they know what all its students have done, but they want to know what you've learned. So I think it's important to emphasize the sort of things you've learned and how you've helped. So imagine if you've done some sort of a volunteering type thing, how you've been able to help certain people in that volunteering, if it's through research, how you worked in a team, things like that, and what you learned from the experience. I think it's really important to emphasize that. So make sure during that question you're not saying I've done this, rather than I've done this, say I've learned, I've gained knowledge about, things like that. I think that's the most important thing to emphasize during that question.
Right. Okay. And also, how important is the body language? And any kind of mistakes, do you think common mistakes students do which they should avoid?
Okay. So in terms of body language, nonverbal communication, I think is really important in interviews and how interviewers perceive you. So I think being able to maintain a good posture, having your head up straight, make sure to make good eye contact, show more of an open, so make sure you're not crossing your arms or you're not crossing your legs. That is really, really important. It shows the interviewer you're engaged in the interview. And I think a lot of students, obviously it's a stressful moment, stressful interview. You might be fidgeting with things, but that is something I think students should practice, because it shows a lack of focus and it shows you're nervous. And in these sort of interviews, the interviewers want to see you're confident with your answers. So being fidgeting or crossing your arms or lacking eye contact shows that you might not be as confident. So those are things I think are important to practice at home. So if you're at home and you practice with your parents or any family members or whatever, just practice not fidgeting, sitting straight, making eye contact, things like that, because those you might be unaware, but they're quite important, and those are things interviewers will have on a checklist. So yeah, I think it's really, really important to be aware of.
Yeah, they might notice. So I think prior practice is very important. Yeah, right.
Yeah, definitely.
If let's say a student does not know any answer and it is not relevant to any specific MMI or panel, if a student does not know the answer, how do they go about it? How should they be answering? Do they just straight say that I don't know? Or should they try out speaking something is one. And second is in experience, what is the challenging MMI station and you have faced or you are aware of, tutoring so many students,
Yeah.
and how should the students be handling it?
Okay. So in terms of like if you don't know the answer, if it's an answer on a knowledge type topic, so something about research that they've asked you specifically, then it's good to say you don't know, because you don't know, but you will you can say I will research it at home, or I'll make a note of it. If it's more of an ethical type scenario that you don't know what to do, then you can take some time to think about it. You can ask the interviewer for any clarifications, things like that. If it's more to do with your opinion, you're never going to be wrong. So there's loads of options. It might not be the best option, but you're never going to be wrong. So you should just communicate what you're thinking, because that's what the interviewer wants to see. And you can give a wide variety of options and then reach your decision. So I think in that scenario, it's important to not say I don't know, but it's important to just sort of communicate what you're thinking, what your thoughts are. But if it is a knowledge type question and you don't know, you genuinely don't know, it's better to say I don't know and I will research this, rather than saying something that you've just you might think it. I mean, if you do think it's that, and you think it's possibly, and you've heard it before, you can say that. But if you have no idea, I think in a knowledge type scenario, it's better to say I don't know in that case, because the interviewers will see that you've tried and you will research it at home. Yeah. In terms of that challenging MMI station, I think the challenging ones are most associated with ethical type scenarios. So I'll share it now. This is one I tend to ask students. Let me just. So that's the scenario if you want to have a read. So as a first-year medical student, you're assigned to shadow a doctor in a busy clinic. You notice the doctors appear dismissive and uninterested in the current patient's concerns. The patient is visibly upset and feels unheard of. What actions would you take in this situation? So this is trying to figure out your problem-solving skills. So this is a common question that I've seen people getting asked. So if you want to take a couple of minutes just to think what you would answer to this question. Obviously, there's different ways to answer this question, but there's specific things that I think you should incorporate in your answer. So this is the model answer that I've created. So you must emphasize how junior you are in this position. It's important. You're only first-year medical student. So I think once you read this question, you see first-year medical student, or you see junior doctor, you see a consultant, you should make sure you know what position you are, because it will affect what sort of actions you will take. I think second thing is ensure the patient's well-being. Obviously, as the question said, the patient seems upset and feels unheard. So it's important to ask the patient, how are you feeling? Obviously, it might not be the best in front of the doctor while they're having the conversation, but maybe later on, go to the patient and just make sure they're okay. Next thing I would say, assess the situation. So consider why you think the doctor was like this with the patient. Was it did they have a time constraint? Were they stressed about certain things? So make sure you know why the doctor was acting this way, and then speak to the doctor privately in a non-confrontational manner. In this specific scenario, I think it's really important to address the patient-doctor relationship, and how it's important to make sure it's not harmed. So by direct speaking to the doctor privately, it makes sure that you're not harming that relationship. And I think this word, the patient-doctor relationship, that those words are important to incorporate into your answer. Then obviously you're only a first-year medical student, so discuss with the senior if you're unsure. They will give you mentorship on how to deal with these sort of scenarios. And then I think it's really important to always make sure you are reflecting on the experience. So always incorporate into your answer some sort of like reflection that you will make after having experienced that scenario.
Okay. I think this is a very good example, and I'm sure the students have Really understood how difficult it is and how to structure the answers. Okay, now moving to the panel-based or one-to-one interview. Now, how different it is with one-on-one interview and panel interview. It's just the difference is there's a panel at one end, and one-to-one it's like with one professor or the team. So, how difficult it is, or how different it is?
So panel, as you mentioned, it's up to 4 different interviewers, and one-to-one is just one interview on yourself. I think what's unique about the one-to-one interviews is it's more of a personal type, conversational type man. It's just you and another person. So if you're able to build a rapport with that interviewer, it allows you to engage in more deeper discussions about specific like personal motivations or experiences that you've gone through throughout your life that has made you more interested in pursuing medicine or dentistry. So I think that's important, because if you're able to build that rapport and find common interest with the interviewer, you can have it can be a really nice, well-flowing interview. With a panel interview, I think you have 4 different interviewers, so it might be a bit difficult to like build that rapport with each of the interviewers. I think it's important when you're responding to questions, because obviously it'll be one interviewer asking you a question. It's important to make eye contact with that interviewer, but also make sure you're not neglecting the other 3. So keep making eye contact, responding to the question, but looking at all of the interviewers, trying to like build that friendly type conversation with all of them. So yeah, I think it is different, but if you do practice those sort of interviews, it's quite easy to get comfortable with the situation. And yeah, it's all about confidence. It's all about confidence in this sort of situation.
Right. I'm sure students do practice and they become confident, but when you are actually addressing it, it is completely a different scenario altogether. So there could be unexpected questions. Maybe they have done, 99 correct things. There could be that 1% where they were not expecting a question and it comes. So in these kind of difficult situations or unexpected questions, how do they manage?
Okay, so I mean, it's important to pause, breathe, take a moment to think about your question. You don't have to answer directly. If it's an unexpected question in terms of like you don't understand the wording, just make sure you're clarifying with the interviewer, because it's okay to ask, can you please clarify the question for me, or can you word it in a different way, and just stay calm. Obviously in all interviews they might be an unexpected question just because the interviewer wants to see the way you react. So just make sure to stay composed, think logically. So try and focus it in your head what they're trying to ask, and just try and respond to the best of your ability. I mean, you're not going to know the answers to all the questions. It's really hard. But if you stay composed and you stay calm, you might be able to figure out some sort of thing, or might relate it to other questions you've answered before. I think that's the best advice I can give.
Okay. Okay. Also, there are a lot of universities who requires personal statement or motivation letter. How important it is to correlate when they are going for interview? Is it relevant that they stick to whatever they have mentioned in the personal statement? And if, let's say, it varies, will it really affect in the admission decision?
So not necessarily. I mean, it depends on the university. The interviews I've had, they always had your personal statement next to them in some of the stations, because I've done when I was applying to university, it was only mostly MMI. So they had the personal statement next to them and they had it highlighted. And in panel interviews, I know because now my university does panel interviews, so I know that's the way they do it too. So they have your personal statement highlighted, and if they want to ask any specific questions about your personal statement, they will if they're unsure about certain things. In terms of like, as you mentioned, if it doesn't correlate, I mean, if you've written something on your personal statement and you're saying something in your interview which they're opposites, then I think they will question you about it. It's important to read your personal statement a couple of times before you go into the interview to make sure what you know what you've written. So if you mention any sort of research or any book you've read, make sure you're aware of this and make sure if they do ask a question about this, you can explain it, and it's not like something you've never seen before. So make sure you are aware of what you've written in your personal statement. So yeah, make sure you've gone through it. You highlight what you think they might ask you about, and if you've written something on your personal statement that you want to explain in your interview a bit more, I think you should definitely put that in and talk about it in your interview if the question is relevant to what you're talking, obviously.
Right. Okay. Now coming to keeping, the question is like how much time you should take to answer in terms of how much duration you should be answering a question. Like in MMI, you have a certain specific time that you need to finish the station within this time. But
Mhm.
let's say for one-to-one interview or panel-based interview, it's an open-ended question and you need to answer that. So how much time they should keep to answer that question?
Okay, so I mean, I don't think there's a time limit in terms of how you can answer questions. It depends on how you feel you can answer questions. So in terms of like, if you um if you're answering a question, you have a lot to say about the question and it's reasoned well, I think continue answering the question. The interviewer will cut you off once they think, okay, you've talked enough about this question. Obviously, for example, in a panel-based interview, it's 20 to 40 minutes usually it can take the interview. So you can't spend 10 minutes just talking about one question. So you do have to keep your time in, but the interviewers will cut you off once they think you've talked enough about that. I think it's also important to realize when you're rambling, when you're talking, you're repeating things. So once you feel like you've already mentioned something, that's when I feel that question, you've fully answered that question. So that's why I think it's important to practice, because it's important to know when you're just going off topic or repeating yourself, as that's when I think you should be like, okay, that's the end of the question. I've talked about everything. That's why having a structured type question, taking some time to think, structuring your question, and making sure you're not repeating is important. So as I said, I think there's no time limit to the question, but I think once you feel like you're repeating, that's when you should end it. Yeah.
Right. Yeah, makes sense. Also, how much weightage this interview, in your experience? Of course, I mean, every university will have their own, guidelines. But as an overall understanding, what weightage does the interview sessions keep in the admission process, like in the admission decision?
So in my case, I think most of the universities here in the UK, how it works is you obviously do your exams, so you need to get the academic on check. Then you have to do some other exams to enter university, and then if you get all of those, then you're allowed into the interview. So most of the students who've applied to that university and who get the interview do have the academic, like have the grades that they need. So the interview was quite important. I would say a wide range of the percentage of who gets into medical school was based on the interview, because the interview shows how well you fit into that university. And I think um, my university specifically really valued that, so really valued what sort of people went into that university. It definitely depends on the sort of university you're applying to, so I'm not sure worldwide how it works. I think you have to look into the specific university, but I would say the interview does count for a large amount of the of the application process.
Right. Okay. So we will try to wrap our set of questions so that we can give chance for the students as well to ask. Can you share that one golden tip for students to leave a lasting impression on the interviewer?
Okay, so I mean, it's obviously difficult. I think just being genuine, and that's something that interviewers really resonate with. So being authentic, they know when a student knows what they're talking about, has researched the things because they're genuinely interested and they have a passion for that career, medicine or dentistry. I think that's the main thing I would say. Like, just make sure your answers resonate with your passion. There's nothing specific that I would say, because if you're how I experienced it in my interviews is sometimes I got interviewers that had specific passion, a specific interest in something, and I was able to grasp that interest. And at the end of the interview, I always mentioned and asked questions about that certain interest, or things that they mentioned in the interview about the university itself or about the course itself. And through those questions, I think they realized, oh, I was quite interested in what they like. I actively listened during the interview in order to be able to make those questions, if you understand rightly. So it's like I made sure during the interview to make notes about what we talked about. So at the end of the interview, I was able to ask very specific questions, and I think interviewers really liked that I did. So I think that's important, being genuine and actively listening through the interview. So at the end of the interview, you can ask very like specific questions on whatever you've talked about. But I think it's important to have some questions in mind for the end of the interview. So I think that's good.
Okay. Nowadays, obviously, post pandemic, there are also online interview sessions. Like, how different it is in an online setup and obviously the on-site interview.
I mean, it's different in terms of like you might feel like it's not as personal because you're looking through a screen. But I think they've adapted it quite well now, where it feels like you are in the same room. So I think I wouldn't worry about if it's online or if it's in person. I wouldn't really worry. I think it's just important to make sure you're making eye contact, because it's really easy when you're in a computer to look around or forget about those non-verbal communication type skills. So I think it's really important to make sure you're still making eye contact, you're still being receptive to the questions. So I wouldn't worry about the being in person and being online at all. It's good if you can practice online. So if you can have one of your family members or someone at school that is on a call, so you can practice online just to know how it feels. But I wouldn't say it's that different. I in my experience.
Okay. And if, let's say, a student is aware that, okay, I have an interview for this particular university and these are the guidelines. So, how early they should start preparing for the interview? Because we have seen that students keep the interview, sessions for the last moment, let's say 72 hours before the actual interview. So, what strategy you think you want to give to the students?
Yeah. So for my interviews, I practice quite a lot early on, just because I think 72 hours before, you don't have enough time to know what sort of skills they are looking for at the university. Um, even I think practicing questions is it doesn't take that long. It might be an hour a week, or an hour every 2 weeks, but just like making sure you're just asking those common questions to yourself, being able to know how to respond to questions like, why do you want to study medicine, or tell me about volunteering experience, things like that. Being able to like articulate your thoughts clearly, it's really important. Avoiding those fillers, things like that. Actively listening, I think it's really important. So I think it's important to start practicing quite early on, just to feel confident and comfortable in the questions that they may ask, and being aware of the questions that they can ask. I think that's quite important, and then it will show during your interview that you are more confident in these questions because you have practiced, and you can tell when students have practiced early on, and the ones that have just the day before just looked through some questions. You can tell in terms of like how confident they are answering certain questions and how they structure their answers. So definitely, I would start earlier on. Yeah.
Right. So I think the students who have joined, this is a very good opportunity to understand that you need to start as early as possible. And we have tutors who are always there to guide you. So Elizabeth, before we, open up the podium for the students for the last 10 minutes, any final words of encouragement or advice for the students you would like to give for their interview?
So I think just during an interview, stay calm, be yourself. I think the interview is a really good opportunity for the university to know more about you, because obviously the only thing they've seen is a personal statement and your grades. So an interview is really good to not just show your grades and your accomplishment, but more about just your personality. So I think just be you, just be genuine. Um, and try and, as I said, practice just to feel comfortable with the questions, and that will allow you to be more yourself during the interview.